Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This micro video is a circulation paper titled Bleeding and New Malignancy Diagnosis After Anticoagulation for AFib. The study goal was to investigate the link between bleeding after anticoagulation for AFib and new cancer diagnosis in patients aged above 66 years. It was done in Canada. Sample size was 119,480 AFib patients. Drug studied warfarin and DOAC. Follow-up period 2 years. Key findings: 4 times increased cancer risk after any bleeding. GI bleeding, there was 15.4 times risk of GI cancer. With genitourinary bleeding, there was 11% increased risk of genitourinary cancer. With respiratory bleeding, there was a 10 times increased risk of lung cancer. Median 45 days from bleeding to cancer diagnosis, often at earlier stages. Clinical implications: bleeding may indicate occult cancer, not just a medication side effect. Timely investigations are needed, for example, endoscopy and cystoscopy. Guidelines are required for cancer screening after bleeding in anticoagulated patients.